Hi, my name is Trinh. I'm a hygienist of over 30 years and also co-owner of Smile and Style. I am super passionate about educating the general public on oral health. It's so important. A lot of times fear and just avoidance is due to the unknown. So I love to be able to use this time and this platform to really educate patients about dentistry in general so we can take the guesswork out of it. Bleeding when brushing is rarely ever normal. I would say probably the only time it is normal sometimes is if you have something transient like food impaction through a popcorn kernel or something like that. But for the most part, if your gums bleed when you brush, that's usually a warning sign of something far more serious than just normal day-to-day bleeding. The most common reasons why your gums bleed is through plaque buildup or just bacteria buildup. So either not brushing an area properly or not brushing that area thoroughly or at all, or flossing. So I tell patients all the time when I see patients with bleeding gums, that's the first thing I ask is how are you caring for your teeth? How often are you caring for your teeth and how are you doing it? And that gives me an indication of that's the most common factor. Obviously there's other factors, but just good plaque control is where I'm looking at for the source of bleeding gums. The best time to see a dentist if you have bleeding gums is immediately. I always tell my patients there's nothing at the store that will treat bleeding gums. Most of the time, the gums take about 20 plus days of not cleaning that plaque off for the gums to even elicit some type of bleeding. So that means that that plaque or that biofilm has been there for quite some time. And sometimes it is already hardened to the point where brushing with a soft bristle brush is not going to be able to be enough to get that off. So I would say get that professional care immediately so that if it is something that we can take care of for you and start the healing process, the better. So the best way a patient can stop bleeding gums at home is prevention. I said once you start seeing bleeding, it means that whatever that's causing the bleeding has been there for quite some time. So my best advice is to once you get your teeth professionally clean, that's the best time to go home and continue that streak of keeping that bacteria, that biofilm off your teeth. Because once that settles in, I tell people imagine a baking sheet. Once you clean it haphazardly and then you put it back and now you're using it again, now by the time you try to clean it again, some of that is really baked on and it's just nearly impossible to get it off with just a sponge. And that's what I feel like the toothbrush is. It's just a sponge. That's all you have at home is a sponge. So if you had baked on buildup on your teeth and you have just a normal toothbrush, there's no way you're getting all that off. And if that bacteria is still on your teeth at any given point, that bleeding will continue. So I would say definitely the best thing for a patient to do at home is to do that type of home care from the get-go. Some patients do experience occasional bleeding gums, and that's usually from inconsistent home care. So maybe they've brushed and flossed that particular area very well, and then they go on vacation or they take a little bit of a break from their oral care, and then they get a spontaneous or a isolated time where their gums bleed. So sometimes that is normal and it will recover. But when you go beyond 7 plus days and now you're on day 21, then your gums are not going to be able to recover from that biofilm or that bacteria sitting there for so long. So I tell there's a sweet spot. Everybody's sweet spot is a little bit different. So I would say don't push it. So I would, if you do have occasional bleeding and you're getting right back on and being super religious and meticulous with your home care, sometimes that will resolve on its own. But that window is very short and it's very different for each person. If you have bleeding gums and you get a professional cleaning and a cleaning that's really designated for what you need, you can get really resolved from that bleeding in less than 7 days. I've seen people where within the first 3 days, if they're cleaning and keeping it at home, they're telling me I'm seeing less bleeding already, or I'm seeing no bleeding after 4 days. So I typically tell people 5 to 7 days is when if you're consistent with your home care and doing exactly what we're recommending. By the seventh day, you should not get any bleeding at all. So if you have bleeding gums and you ignore it and not get any professional help or the correct professional help, what happens is that bacteria will continue to chronically disease that area and really start to eat away the bone that supports your teeth. And when I tell people their bone, I literally tap on my cheek, like, do you feel that jawbone? That's the bone that's getting deteriorated over time as long as that bleeding or that chronic inflammation is sitting there and not being thoroughly addressed. So once that bone is destroyed, it doesn't grow back at all, no matter how much you do after the fact. So it's super important to make sure you get the correct care. A small cell, being that I am a co-owner and also a hygienist, we really prioritize gum health as a part of the initial and continuing care of all of our patients, whether you're a new patient or a patient of 30 years plus. Gum health is the pillar of overall health because if your gums are healthy, it's supporting all of the teeth in your mouth. So whether you're cavity free or not, if your gums are not healthy, you're going to be in a bad way in terms of keeping those teeth long term. So it's something that we really focus on by doing perio charting on every single patient, every single time, taking X-rays, and really being able to also integrate that over with AI so that we can really be subjectively looking at things and then objectively looking at it through AI so that we can be able to see where this patient is. So we really do take pride in making sure that perio health or gum health is the very first layer when we check our patients. So if you're at home and you're struggling with bleeding gums, I would recommend the first thing is to get in with us to be able to do a comprehensive exam where we're, again, at our office, our comprehensive exam really goes hand in hand with gum care and really disease detection. So that way you'll be able to have a better understanding because there's so many layers when it comes to gum disease or gum health that it could be early stage where we can do something that's very minimally invasive and be able to take care of that patient and reverse any issues. And then sometimes if it's a more of an advanced stage, there's another way to kind of customize that game plan so that we can keep those teeth as long as possible. So it's really important that if you're even thinking that you may have something, the best thing is to come in and be able to establish your care and get a customized game plan.